Many people think of the hospital and their co-workers as extended family, and at Rhode Island Hospital it's no different. But for some it's more immediate. We have many nurses who have followed in their mother's footsteps and become nurses themselves, and for them, nursing is truly in the blood.
I remember my first critically ill patient. I remember his name. I remember the beds he was in. It's just phenomenal. Yeah. And again, working with the doctors, having that close teamwork and relationship with your colleagues and other departments, it was a fantastic experience. So if I had to do it over again, I'd be a critical care nurse.
I probably did want to become a nurse because of my mom without really even knowing it. Just growing up with it all in my family, I just was always interested and loved everything, how proud everyone was of their job and everything that they did. But I don't really know why I decided to do it. It was just interesting, and now that I've been a nurse for a while, I can see that it was just the role models I had in my life. My grandmother loving her job all of her life, my aunts, my mom. It was just something to look up to and something that I really admired in them.
She was actually a sophomore in college, and when she came home and said, "You know what, Mom, I really think I want to be a nurse." Ooh, it was great. It was the best feeling.
Growing up, I, kind of teeter-tottered in between what I wanted to do, going between pharmacy and thinking about nursing, and I think one advantage that I had over other individuals was that my mother was a nurse, and not only was she a super nurse, but she went back to school and she excelled in nursing, and she showed me that by becoming a nurse, I can be and do whatever I want to do.
This is probably the greatest hospital that I've ever worked in. We have the greatest nurses in this organization, and I think one of the things that I enjoy the most about nursing at Rhode Island Hospital, it's the most challenging experience from both the heart and mind perspective of nursing that one could possibly ever have. The patient population we care for is so challenging, both from the complexity of the medical issues and the nursing issues, but also the caring challenges that our patient population puts forward. And our nurses go above and beyond every day, providing great care for our patients. So I'm just proud to be part of this organization. It's great to be able to work in a hospital where your daughter is part of that environment. I'm just so proud that she's had this incredible opportunity to work in a surgical ICU where the sickest of the sickest patients in the state are being cared for by my daughter.
Although we both, come from similar backgrounds, secretary to nurse and mother who was a nurse, we're so different in the field of nursing. She loves hearts. I don't like hearts. I like trauma, I like surgery. I want to be a nurse practitioner. She wants to be a clinical educator. Rhode Island Hospital really allows you to branch out and do whatever you want to do within the field of nursing. We take these people, and if they went to any other hospital, they would send them here. We're the ones that can accept them, and we have the technology and the skill and the doctors and the nurses here to really put them back on their feet. And I'm proud to work here.
Very noticeable working over here in the Bridge building now in cardiothoracic intensive care. I'll be taking care of my patient, the heliport's right outside, and I'll be talking to a patient, and suddenly you can basically see the person coming in, and my thought is always saying a little prayer for the person in the helicopter that things will go well, because no matter how hard you try, hopefully we have great patient outcomes all the time, but can't always count on that. Need good nurses and doctors?
Mostly nurses.